Looks like the fishing bandit.
That's actually my son-in-law.
Looks like a lake trout or something. Was it a
There's
walleye?
lake trout.
Yeah.
We went, that's my daughter with hers. Got a couple nice fish. We went on Superior yesterday.
Mm.
It felt like it was 35 degrees when you were out in the lake.
David, is the meeting that you switched to 11 today the one that was going to be yesterday or tomorrow?
No, it was always going to be today, but when I set it up, I inadvertently put 11 p.m. instead of 11 a.m.
Oh, okay. What's that meeting for? Is that the one coming from your committee with Moore and Mickrit?
Is it more? I'm sorry, I included you, Matt, in my comments that I'm going to share this morning, so I'm going to make that Josh.
What, is that the Economic Development Committee?
Yes.
Yeah.
Yeah.
Okay.
Yeah, so we're meeting at 11.
Okay.
So
Have you
And I just
have
got
you
a
had
text.
one meeting already?
we did.
Are you going to update us on that today?
Yes.
Okay.
I just got a text from Steve Chafee that he won't make it today. He said, I'll explain later.
What are you doing for the 4th?
Probably the same thing we're doing on the 3rd.
Yeah.
I don't, maybe we'll cook a lake trout.
So Ryan, did Debbie drop off?
Hi, John.
Yeah,
Or
she's
Steve.
going to join us herself, so she's got to wait till 5 minutes before the meeting. So
Hey, John.
You better,
Morning, Mr. Ludwig.
Mr. Ludwig. Wow.
Hey, John, I don't know if you got an updated appointment this morning, but I had inadvertently made our 11 o'clock meeting today 11 p.m. instead of 11 a.m. So I just updated it this morning.
All right.
Only cities meet at 11 p.m.
The only better time would be just wait till the bars close and have the meeting start.
How's it going, guys?
Hey, Josh. How
Good.
are
Hey,
you?
Josh.
Good. Did you guys get a lot of rain?
Yeah. What'd you guys have up there?
I had at 1.39, I think it said.
Yeah, that's what we had, 1.4. What'd you get, John?
Right around 2 inches there we got.
Oh, really?
Yeah, we ended up with 1.65.
Wow.
Well, I think we needed it. That's for sure.
Oh, man, we could use another inch today.
Yeah.
Hey, Josh,
Yes.
we have a steering committee for the CARES relief money at 11 o'clock today.
Okay.
I think I sent that to Matt Ludwig instead of to you.
Okay.
So if you're available, I'm just going to forward you the link to the appointment.
Okay. And what is it again? Steering committee for?
Coordinating between the cities, townships, and counties on the CARES Act funding,
Okay.
coronavirus relief money.
And that's at 11 this morning.
11, yep.
Okay. I don't know for
Assuming
sure
we're
if I'll,
finished with this meeting.
okay. I don't know for sure if I'll, if it'll work, but I'll try. How about that?
Hey, David,
Yeah,
in your update today, you're gonna explain that, because I'm confused about what that money is really gonna do for Pine County.
I will explain that,
Okay, good.
and I will answer any easy questions.
Well, we got him. David, have you followed any of that stuff from leftover from the meeting we had with the valuations with that one lady?
I have not done any follow-up.
Could you check in with Lori and see if she needs help, or I get copied on these things and I've kind of got lost in the whole.
Yeah, and that was just one of those things that I was ignoring last week while I was on vacation.
Yeah, oh, that's fine. I don't want her to be out hanging out
Yep,
on a limb if it's something we can help with.
yeah, no, I have it on my follow-up list.
Thank you. Hi, Becky.
Morning, Jackie.
Good morning. How are you?
Good. Nice to see you.
Nice to see you all.
Okay, I have 9 o'clock. So we will I'll read our little statement. The governor of the state of Minnesota has issued executive order 20-01 declaring a peacetime emergency and from COVID-19 on March 24th, 2020, the Pine County Board of Commissioners declared a local emergency for Pine County, and based on these conditions, the chair of the Pine County Board and Commissioners has determined that the requirements for Minnesota Statute 13D-021 Subdivision 1 have been met, and it is not practical or prudent for members of the county board to meet in person. Members of the county board will join the meeting remotely. Public is invited to join, and the numbers are indicated. For more information and watch the live stream broadcast of this meeting, go to the Pine County website. So we'll call the meeting to order and rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Any additions to the agenda?
I have no additions, Mr. Chair.
Ludwig will move the agenda.
Moral second.
Any discussion? If not, the clerk will call the roll.
District 2, Commissioner Moore.
Josh,
Yes. Is that better?
Yeah.
That's better. Thank you. District 3, Commissioner.
Commissioner Chafee has an excused absence.
Thank you. District 4, Commissioner Mickert.
Yes.
District 5, Commissioner Ludwig.
Aye.
District 1, Chair Holland.
Yes. We'll move right on to CARES Act funding discussion. And I believe David will start us off and give us all this pertinent information.
Mr. Chair, members of the board, this is David Menke, County Administrator. Yes, when we scheduled this meeting, the legislation was at a standstill, and we did not know if the funding was going to be approved or not. So we did learn last Thursday that Governor Walz, using his executive authority, did release the CARES Act funding. And so the distribution to local governments basically follows what was in Senate File 47. And the governor's executive order has to run through the Legislative Advisory Commission. We've heard from AMC that it sounds like all of those commission members have signed off on it, so there should not be a delay on that. But a brief history, we remember the CARES Act was approved by the federal government in March and allocated approximately $2 billion to the state of Minnesota. Under the governor's order, $841 million is being distributed to townships, cities, and counties. And cities and townships of 200 people or more receive a direct appropriation, and jurisdictions under 200, their appropriation goes to the county, and they will have to request it from the county for reimbursement. And all jurisdictions have to certify to the Department of Revenue that they will use the money appropriately before they can release the funds. We did submit our certification last Thursday, and so we should receive our share of the funding within 6 to 8 days, I think is the timeline that the Department of Revenue had set out. So hopefully within the next week or so, we will have our funding. And the funding breaks down. There is about $3.6 million to Pine County, of which 54,000 of it is for jurisdictions under 200 population. Collectively, all of the cities 200 and above are receiving just over $880,000, and all of the townships that are population 200 and above are receiving about $425,000. So the grand total of funds from the CARES Act flowing to Pine County is just over $3.9 million. And
so David,
Yep.
So the 3.6 million comes directly to Pine County, and we just only have to minus out 54,000 of that. That's going to smaller jurisdictions.
Yes, and
Okay.
the expectation is that those jurisdictions would apply to the county with an application of what their eligible expenses are. And
Yes.
so, I'm sorry, Steve, are you done?
Yes.
Eligible expenses are expenses that are directly related to COVID-19 response. And so for the county, those expenses are things like the non-federal share of the FEMA grant, the workers' compensation costs, improvements in the courthouse or other facilities that we made, such as sneeze shields, hand sanitizer, signage, etc. They also can pay for coronavirus related time off for employees. And each of the jurisdictions can pay for those similar type expenses. So those would be our direct costs. And the funding has to be spent by the end of the year. City and township funds that are not spent will roll to the county mid-November, and then mid-December, I think it's December 15th, but mid-December, any unspent county funds will roll back to the state. And so of that $3.6 million that's coming to Pine County, we believe that most of that is going to be available for business and community relief, which really translates to grants to businesses and potentially some community organizations that have been hard hit by the coronavirus. And that's at 11 o'clock, we have a group of cities that are going to be on a web call with us. And I reached out to a couple of the Township Association officers over the weekend just to let them know that we were interested in coordinating and trying to, I guess, start that communication. I haven't heard back from them yet, but we will make a formal outreach to all cities and townships. I'm hoping this week with the idea that the community relief piece is better done in a coordinated fashion. So if you're a business in Sandstone, for example, and you think you're eligible, well, what would that application process look like? Who would you apply to? How would it be reviewed? If we can do that with one point of entry, whether you're in Sandstone City or Sandstone Township or Pine City, whatever, we think that's more positive. And we did have one call must have been 2 weeks ago, with some of the larger cities, and there seemed to be support for that idea. And John, I think you were on that call as well. If there's anything you want to add to that collaboration we're working on.
No, yeah, they're willing to take whatever they can get themselves on.
So in a nutshell, I guess that's what we know right now. There is a webinar with the Department of Revenue on Wednesday of this week that's going to go into more detail as to exactly what costs can and cannot be covered and what that process is going to be. I think it would make sense for us to offer to, if there's a way, and I've posed this question to AMC to pass on to the Department of Revenue so we can get some clarity, but to certify and receive the funds directly, you have to have a DUNS number and you have to be in the SAM system at the federal government, which I'm guessing a lot of our small cities and townships, even if they're 200 and above, are not in the SAM system and don't have a DUNS number, and that's going to be a hurdle for them. And so if it's possible for us to offer that we would handle those funds for any city or township that wanted us to, even if they were over 200 population, that might be an administrative piece that we could add because we have that infrastructure and are in the federal system and the state system.
David?
Mr. Chair. Oh,
Yeah, go ahead, Matt.
thanks for doing that, Dave, on that FEMA, or that contact with the feds. You had said that some of the funds could be used for COVID time off. Would that include furloughed people? Is one question. And then my other question is how are we going to make sure all those small businesses, I know it's early, but I worry about those small businesses, the barbershops, how do we get them, or are they, hopefully the cities will know and can work that out, but.
Yep, on our initial call with the cities, the city administrators, and on the call was Finlayson, Hinckley, Sandstone, and Pine City. But those city administrators had a takeaway of doing some outreach to their business community to start that process. And so I think, we'll build the network of working with the cities that are already, their existing networks, and then the chambers of commerce or any other organizations that work with businesses to get the word out.
Oh, yeah, that's okay.
So, David, my question is, do we have an idea out of that 3.6 million, because we have incurred costs for all the sneeze seals and all that. If we add all of those things together, did we spend 100,000 or 500,000 or, so how much of this 3.6 million are we going to have to deal with?
And how much will we spend through December 31st?
Right.
Whatever the end of the year is.
Right.
I think that it will be probably closer to the 500,000 than the 100,000, but it's
Okay.
not going to be $3 million, right? So
Okay.
we're going to have multiple millions of dollars to push out into the community to those businesses and the eligible organizations. And I say eligible organizations, not having any idea really what those are if you ask me to name them, because we have to work through the process with the Department of Revenue to find out how we can, who's eligible for the funding and how we would work that. And because Pine County does not have the internal infrastructure to accept applications and review applications for funding, I did reach out to the Initiative Foundation, to Don Hickman, to see if they were interested in coming to the table. And he said they are. And I only had some cursory email with him, but I think they could be a critical partner in helping with that application process so that it's electronic and it's easy and there's a process already in place, because they do a significant number of grants in the region.
And on the furloughed piece, furloughed employees, would they be covered underneath any of that?
I don't know.
Mm-hmm.
I think we have to do some research, and it might depend on why they were, the exact circumstances.
Okay.
But if they were furloughed, well, let me just say we have to do some follow-up.
Sure.
So I guess we've just left the station with this piece of it. Since the largest jurisdictions of 500,000 and above received their money back at the end of March. And so we're going to be looking to some of those larger jurisdictions for a little bit of guidance. And if we can borrow templates that they made for community funding, et cetera, we'll use that. But at this point, it's a work in progress, and we'll be doing reach out to our cities and townships, and then using our steering committee to kind of frame up the topic or the issues, and then bring back info to the county board.
Funds that we do not use, do we return to the state then in December 15th date? Is that what it was? Or
yes, I know it's a December date. I think it's the 15th. And then the idea is that if the state has eligible expenses that have not been reimbursed yet, that any excess funds they would be able to capture. And then at the end of the year, all the funds go back to the federal government if they're unspent. And there was a little bit of discrepancy in some of the early legislative language with spent or encumbered or dispersed. And the clarity now that we have is the money has to be spent by the dates, not just encumbered or things on order. The money actually has to be out the door.
Can't get an invoice on the 15th if that was
No.
the date. Yeah, okay.
So on one hand, there's a great urgency to do stuff quickly because we want to get money out to the business community to help support them, because we know there's a lot of need. There also has to be thought to, this money is to last 6 months through the end of the year, and we want to be thoughtful and capture all of the expenses that we can, so the local taxpayer isn't burdened with those as well. So in my mind, there might be a couple of rounds of funding for the community piece of it, so that, because we also know, looking nationally, that and maybe Sam is going to get into some of the detail of how the spikes are coming back. We know some states have opened up and now are looking at closing down again. And so if that happens in Minnesota, if we spend all of our money in July and we end up having significant costs in the fall, we would be short at that point as well. So a lot of work to do, and I'm confident that we have a lot of representatives. We'll have a lot of representatives at the table to have conversation and make good decisions for the community. Any other thoughts or questions on the funding?
I think that committee has their work cut out for them, and I hope we can get some guidance, because in talking to some small businesses, some have worked really creatively and probably almost improved their bottom line. And some have threw up their hands and said, you dealt me this bad card and you screwed me over as a state of Minnesota, and you owe me something. And so I think there's going to be a setup for some very hard feelings amongst the business community, where some have transformed their business into a different model, and their bottom line probably is doing okay, and others that have just kind of thrown up their hands and said, I'm screwed. And some of them truly have been affected. I mean, there's just no way you can ever make up for what they lost. And so you guys are going to earn your money, I think, in figuring this out. So good luck.
Yeah, and Sam just threw a question out on schools and eligibility for funding. I think it's a two-part answer. I think part one is schools have received direct federal aid previously, so that's covered some of their expenses. But I think, yes, some of their expenses might be eligible for county or city or township CARES Act funding. And then it would just be a question of, does it meet the criteria of eligibility? And then if so, is that how we would want to spend the money? And Steve, I think that's a little bit of your question is, there might be some discretion involved, and how we evaluate and make those choices is going to create hard feelings if you're the business or the entity that thought you should have gotten funding and there wasn't enough money to go around.
Yeah, I even think of daycares that, you can't have kids piled up anymore.
Yeah, and the other piece that's very unclear right now is if an entity has received other money from the state or from the federal government, how does that impact their eligibility for this CARES Act funding? And at this point, it's not clear if double dipping is allowed or not allowed. How many different pots of money can an entity receive funds for? Or if the answer is as many as they can apply to, then does that factor into our decision making? If they've received other funding already, would we rank them lower than an entity that has not received other funding?
Mm-hmm. Yeah, I would think that first round would go to all the businesses or whoever that have $0 of assistance.
This is Denise, Mr. Chair, members of the board. I just wanted to add some quick stuff in there. We had applied for the FEMA funding too, so don't forget that little pocket that's sitting out there too. And we had forwarded that also to the schools and the cities. So things that aren't covered by the CARES might be covered by the FEMA funding. So I know 3.6 million is very substantial, and hopefully that takes care of everybody, but there's also things that the FEMA funding can also take care of. So not to double dip or anything, but it's there. So thank you.
Thanks, Denise, and keep David informed of where you're at, because I think there will be some evaluation process we're going to have to use, so some entities aren't getting double the money and some are getting $0.
And just maybe to close up on the accounting piece of it, there are record keeping requirements. It is public money, so we have to have good records. We are going to set this up as a separate fund so that it's not commingled with anything else. and it will have, it will show revenues and it will show expenses, whether it's a payment to a business, whether it's a payment for, protective glass at a counter or IT improvements, any eligible costs. And then at the end of the year, since all the money has to be returned, it should zero out. And so Kelly has been working on that and thinks that's the best way to account for it. It would be to create a separate fund so it's not commingled with anything. And so I know we've got some staff on the line, so you may have expenses that have been showing up in your operating budgets that will now likely get moved out of your operating budget into that separate fund.
Thanks, David.
Yeah.
Just keep us all informed where this is at, because I think we'll all get a lot of questions about how this is going to work. And I find it interesting if the numbers on our sales tax collection keep holding true to form. We have obviously some businesses that haven't collected diddly squat in their sales tax because they haven't done business. But obviously there's some businesses that are doing more business than normal because our total overall sales tax collection as of the last report, we're still up. So that kind of amazes me.
Yeah, and anecdotally, I have heard from other administrators who also have local sales tax, and it seems that some of the regional centers are seeing a decrease, like a Mankato or a Blue Earth County, and some of the greater Minnesota counties are seeing, no decrease or slight increases. And so I don't know how much you can read into that, other than the impact is maybe people are staying more local to do the shopping that they have to do rather than traveling to regional centers or to the Twin Cities.
So I have one more question, Mr. Chair.
Yes.
Just back to businesses. So let's just say you were a restaurant and you're forced to close for COVID. And then you decided like, oh, I just can't make it. And now I close my door. So what happens to a business like that when you go into this CARES Act dollars? Is it enough to bring them back into business? Can they apply for that much money, or are they just out of the loop?
I think, Matt, that's the $1 million question, or $3.6 million question, because you talk to the next restaurant owner and that person says, we were given an opportunity and we had to change our business plan, but we had positive cash flow every week of all those weeks, the 85 days we were closed down. So they would be probably somebody that would not be very happy if somebody who just threw up their hands and closed got money and they worked their tail off trying to survive and didn't get anything. That's what I'm saying. That's going to be the tough call for how we figure this out.
That's what I was going to say is, that first round when and all the businesses had the opportunity applying for that first funding. It wasn't hard to get that funding. And I know almost everybody that applied for it got it, at least something to help them out through that time. So that will be, like you said, David, as far as if someone's already received some funding, whether or not they're in the small business SBA type loan was different than other type loans. So yeah, it'll be interesting, but there was a lot of opportunity already out there to work through this too. So.
Well, committee, good luck. that it, David, on the CARES?
Yep,
funding for now?
I don't have anything else. Thank you.
Okay, I would just alert all the commissioners and staff members to watch for updates because this is gonna be a fluid thing. As David learns more, as we all learn more, as AMC learns more, they'll keep pushing information out. And, you know, if you get questions from businesses, it's okay to say we do not know yet, or we're working on it. So I think that's the best answer we can give at the moment. Because people are, it's their business, it's their dollars that they're spending. So I think we have seen some very, very creative people in our communities come up with ways that are maybe a little bit different of how they're doing business. But I think, you know, they've survived and hailstorms and everything else, and they some people have adapted well and some haven't. So I don't know what that says in the end, but we have a lot of resiliency in our communities, so they'll get it done. So we'll move on to the coronavirus response update / public health update. Is that going to be led by Sam?
That is me. Hello, Sam Lowe, Director of Penn County Public Health. Let me share my screen. I have a PowerPoint because sometimes visuals are nice. 2 seconds. All right, and view.
And we are seeing your screen, Sam.
Fabulous, thank you. Bam. All right, so the goal of this presentation is to give you, the same information I normally do at a COVID update. So the basic numbers of what's Pine County, how's Minnesota, how's the country. But then also kind of give some more visuals about, well, really, where are we in comparison to other states and where are we in comparison in the world? And then also do a little bit of comparison to other major pandemics and what it kind of looks like, because there's a lot of comparisons going on and sometimes the data isn't always super solid. So I'm giving really, good data from solid sources. So first I just wanted to kind of review what Pine County Public Health is doing, since we were just talking about all this money that we might be spending with CARES Act, and hopefully Pine County Public Health is built into that budget a little bit there, because we are going to run out of, we had state allocated funding of $75,000 that will probably run out next month. So we are doing case investigation, contact tracing. That has gone really well. Inevitably, they always show up on a Saturday. I don't know why that is, but we get a lot of cases popping up on the weekend, and that's fine. We have people working the weekends, so we get them called within 24 hours every case. So some of the questions that we would do is, where have you been since 2 days before you were infectious? Who did you come in contact with? Did you travel? What symptoms do you have? So we do a lot of just investigation around what exactly were you, where exactly did you go, so that we can reach out to those people as well and get them quarantined, which hopefully will reduce the spread further because they might go out and spread it further. We still have our hotline running. It is, it's usually like a couple calls a day. It's never been a massive influx of calls on any one day, but it has been a good solid resource of consistently being available to people who have questions, whether it's where are the cases, or which we don't generally tell them, or, how do I come back and be safe? Like, do I need to wear a mask when I go to the bank? Here's the guidance, things like that. Schools have also reached out, which has been a really great touch point for them to have someplace to call directly. And then the hotline forwards as needed. We also do essential services. So if you are under quarantine or under isolation and you need something, we're the ones to call. So we figure out, okay, you need medication. Do you need help of like paying for it, or do you need help just picking it up because you're not supposed to leave your house? And we coordinate and figure that out as needed. So it's really meant to make it easier for you to stay in your house and listen to us when we tell you, please don't leave, please stay home until you're not infectious anymore. And we've also been doing consultation for businesses and organizations around reopening. So we've had schools call us and say, can you look at our youth sports programs? Because they need guidance or they need a plan, a reopening plan for their sports. So we would review it and give them notes and feedback and say, this doesn't make sense, or this isn't quite accurate based on the guidance. So we've been kind of a resource for the community in terms of just all this information that comes in from the state and how to apply it to your business or your organization. So where are we at? I can tell you right now that 97 is not right. We're at 100. So we had a couple over the weekend, but everything else pretty much remains the same. We have a 1-year-old. We had a 1-year-old a week or so ago, all the way up to 74 years old. So quite the age range at this point. Nobody's died. 2 hospitalizations still, which were very early on in this. So it's nice that that has stayed steady, and that all of these new cases so far have been found within the community and not the Willow River Correctional Facility. I will say that yesterday we got one in our queue that we weren't supposed to get because their address was FCI. So that's concerning, but I don't have a ton of details on that quite yet because it's really new. So I have a case in the federal.
Mr. Chair, can I ask a question?
Yeah, go ahead. I can't say yes, but.
On the 100-ish cases that we have and the 2 hospitalizations, so that 2% hospitalization rate, is that like what would be expected, or is that how does that compare to what we might expect, I guess?
Actually, our hospitalization rate is quite low in comparison to the overall general population rate of around, I want to say it's about 15%. That might be slightly dated in my head. I haven't looked at that number in a while, but somewhere around 10 to 15%. So we're low, and it's likely because a lot of our cases were from Willow River, which are generally younger, generally healthy people who caught it. So they were at less risk of being hospitalized.
Okay, thank you, because that's a good distinction, because our general population is probably more of an at-risk community.
Yeah, just knowing our general health status and indicators that we track in terms of obesity and smoking rates and all these things that generally make you more at risk of being hospitalized. Yeah, Pine County is on the higher risk end of counties for Minnesota. And then, of course, the general asterisk for cases is that number is low because there's a lot of cases we just don't know about because they weren't actually tested. I know the 1-year-old that none of her other family got tested except one other person, I think. And they were tested too late because they all figured if one of them has it, they all have got it, which is a, solid assumption. So there's at least 5 other people who could have potentially tested positive that just didn't get tested. So pulling out a little bit in our zoomed in focus to Minnesota, we've got, these are all as of last Wednesday when I completed this PowerPoint, so little dated numbers, but we had around 34,000 cases. They were hovering around 200 to 400 a day. The past couple days have seen a slight increase in that number. Yesterday's was like 523, I want to say. So we are seeing a slight uptick, but nothing too concerning at this moment. And we're currently in about half of states that are showing a decrease in new cases. So I want to show you this. Oh, hold on. Where'd it go? There it is. I'm going to jump ahead a bit and I'll jump back. So this is the R0 in every state right now. So R0 is how infectious the disease is. And it's not a fixed number when it's when it's spreading. So you can see the impact of social distancing and masking and stay-at-home orders. Those all impact the effective infectious rate. So you can see that Minnesota here is actually doing really good. If you're under a 1, it means that for every 1 case, less than 1 person will become infected. So that means that it will slowly kind of die off, but very slowly. And that's only if you stay under 1 forever. You can see that a good chunk of the states are actually at or above 1, which means that it will continue to grow. And as it gets higher up into this 1.4, 1.6, that's when you get your really exponential growth. So those are concerning states. So Minnesota's actually doing pretty good at this moment. So we jump back. So nationally, I'm sure you've listened to the news over the weekend. Maybe you haven't. We're not doing all that great as a nation. We're up to 2.5 million cases, like 125,000 deaths. So if you look at this chart here and you look at the dotted line, which is the rolling averages when you do not include New York or New Jersey, you can see that once we started all the social distancing and stay-at-home orders, we flattened that exponential growth. We did a good job of stopping it from continuing to grow. We didn't actually make it grow less. Like, we didn't stop it, it just flattened it. So good job there. But now we're back up to this uptick. And so we're growing, and it stems from a couple states in particular, but there's a good 20-some states that are seeing growth. So we're not out of the woods by any means. And this is from 5 days ago, and the trends just keep continuing. We're going above that first peak right now. I think we've had more than 30,000 cases yesterday. So it's definitely interesting at the national level. Also, if deaths continue at the rate they have been continuing on, by the end of the year, it will be the 3rd leading cause of death in the United States. So behind heart disease and cancer, and everything else is less common than COVID. So about 1 in every 10 deaths would be caused by COVID, which is a lot. That statistic kind of surprised me. So here's kind of a good image of what this country is looking like as far as hotspots. Florida over the weekend, oh boy, had about 18,000 new cases. So they 9,000 and 9,500 cases, I think, Saturday and Sunday. So they are quite the hotspot. Texas is equally as concerning. California has a large number of cases as well, but they're a bit bigger, so balance that out. So you can kind of see on here that along the East Coast, they're actually seeing some decreases. So they've got that blue color, along with Michigan and Chicago, which did see some spikes earlier on, and now they're kind of falling, versus the dark orange and the red, which are the kind of the hot spots that are happening right now. And I think the thing to remember with hotspots is that they can happen anywhere if you get complacent and you think this is going to go away and you're going to be fine. So if you are consistent with following guidelines, increase in cases that you can handle, it's this sudden flood of cases that they're getting with Florida and Texas that are really concerning, because that's when you get, I saw a picture from yesterday that was an atrium of a hospital that had beds set up in Texas. So that's their surge capacity. That's what they planned for, is putting beds in the atrium, but they're there now, which is kind of crazy. So that's what we don't want. Slow, steady, manageable growth. Oh, go forward. There we go. All right, let's go over that. So pulling out even further, we have 10 million cases globally as of today. And I thought it would just be an interesting comparison to look at EU versus Europe, because we're generally pretty similar in terms of, economic status. It's about the same size if you take the entire EU and compare it to the US. And we're not seeing the same decrease that Europe is seeing. You can kind of see that the overall Europe kind of dropped really precipitously in April, and they've stayed low. They've done a good job of just being very cautious about their reopening, being strategic in what parts they do reopen. And the US you can kind of see right here with the orange line up above that this is a per capita. So you can see that Spain actually spiked much higher than we did per capita, but then dropped. The US has never really had that really solid plunging drop. We just kind of flatlined. And now we're going back up. So the EU is a better comparison at some places like South Korea. You see a lot of comparisons to South Korea, but they have a better infrastructure in place in terms of responding to a pandemic because they've had some more recently than we have. So I like EU as a better comparison. And really, the experts are really saying that the US has been worse off than Europe because from the beginning, the US has had a really piecemeal approach to this. It has not been, consistent across the board. It's been each governor figure it out on your own and good luck. The virus in general has been very politicized, which has not happened in Europe. It's been very much the science says this, so this is what we're going to do. And we have not seen that in the US, which is a challenge for scientists and public health experts. That I think public health was really unprepared to handle that because they didn't think it would happen because it's a virus. So I don't think we were ready for that. There's been a push to reopen as soon as possible, which has not really happened in Europe. They were very cautious. And then a lack of consistency around just the messaging around public health and guidance. So whether or not leadership wears masks or commentary around testing has made it really challenging for public health to have consistent messaging across the board. And there is talk from the EU is going to ban travel from the US indefinitely because we are the hotspot, which they are not anymore, and they're trying to prevent it. So it's just a really interesting comparison for the US versus Europe in terms of what's going on, considering they have really similar resources that we do. So what's helping and what's hurting us right now? What pushes the curve down? What causes us to have less cases? Wearing masks. Please wear masks. I went grocery shopping this weekend at Walmart, and I was like one of 10% of people wearing masks, and it was very frustrating. We've seen with the mass gatherings down in the cities, the majority of them were wearing masks, so they did a really good job, and we haven't seen a related uptick in cases, which really suggests that masks are really important in that. And being outside, which is great for Minnesota right now. Go out, enjoy the outside, because it's basically being outside, the wind just circulates it and dissipates the virus really quickly. So it's a great option for people who want to be doing something, do it outside. Things that are pushing the curve up. The theory right now is that there is not a seasonality to this, like we thought there might be. And you can kind of see that down south where it's very hot and they're having lots more cases. The theory is partially, they think, because people are spending more time indoors down south with it being very hot and staying in the air conditioning, which is a closed system, air circulation, just cycling that virus through the air. So it's an interesting, thing. Just get outside, wear your masks. And it's just that people aren't listening. The lack of compliance is really pushing the curve up. A survey showed that only a third of people are wearing masks every time they're in public, which means 2/3 of people aren't. So it's just frustrating from a public health perspective that people don't listen, and it's very politicized, and I don't know how to fix that.
Mr. Chair, can I interrupt with another question? I'll take that as a yes.
I think that means yes.
Sam, so early on, there was a lot of discussion about surface transmission and how hazardous that was for paperwork or counters or things like that, as well as, the aerosol type. Is there been any more clarity as to the various rates or likelihood, however you might measure the transmission with surfaces versus the aerosol in-person kind of thing?
Yep. So the research right now is showing that while yes, in theory, in a laboratory, you can definitely get transmission through surface touching because the virus can live for X amount of hours, whatever it is, on a surface. But the primary mode of transmission is through aerosol and droplets. So it is from me standing right next to you and talking at you or sneezing at you or being within your just same air circulation for the right amount of time to get you enough virus, exposed to enough of a virus to catch it. You can technically catch it from touching surfaces and then touching your face. So continue to not touch your face, continue to wash your hands, but it's not the primary mechanism how most people are catching it. So
Thank you.
We still advocate for washing hands, but that's true across the board any day. Yeah, I know people were very concerned early on about wearing gloves when they go grocery shopping, and that's not really concerning as long as you just wash your hands. So hopefully that helps people. So I wanted to kind of touch on this a little bit, this idea of changing the mindset, because there's a lot of rhetoric around no matter what's happening with the cases, there's this negative mentality about this. And I get it because I'm so tired of COVID too, and I want it to be over. But it's not going to be gone for a while. So, if cases are low, like right now in Minnesota, we're doing pretty good. So why people will say things like, why are we doing work when there aren't a lot of cases? And really, you need to flip that mindset and think, I'm so glad these interventions are working and everyone is working together to keep cases low. We're doing a good job. Let's keep doing it. Don't just suddenly say cases are low, so I'm not going to wear a mask. I'm not going to social distance. The reason cases are low is because you're doing a good job. So keep doing a good job. And in places where you might see a high number of cases, people would say things like, why are we doing all this work when it's not making a difference? Which is kind of a hard thing to prove because there might be more cases if you weren't doing things. But really the question is, what do we need to do better to keep our communities safe? So it's just a flip of mindset so that you're looking at it with a different lens and a less negative lens. And I think particularly true in our area is this idea of when there are low cases just in our area, well, it's not happening here, so why should we have to worry about it? Most of the cases were in the prison, so why should I have to worry about it? We're fine. And you got to flip that mindset and just think, let's just keep doing what we need to do so our cases stay low. Because you can see with the hotspots down south that it doesn't take much, doesn't take a long time for cases to go from super manageable and easy and relatively low to 9,000 in a day. So it's just, you just kind of have to flip your mindset a bit about it and look at it differently and say, yes, we're working together to do this, to keep our cases low. I'm so glad we're doing this together. And yeah. Another thing that people like to say, and they've said it slightly less frequently lately, I've noticed, but they like to say that it's just the flu. It's just like the flu. So I figured I would compare it to a couple flus. So you can kind of see 6 months of COVID, our number of cases and deaths versus the 1918 pan flu, which is our big pandemic flu that we had 100 years ago, versus just a regular flu season from 2018 into 2019. So you can see that, cases were probably going to be about the same from last year's flu. Significantly more people have died from COVID already, and it's not even a fair comparison of time or number of cases. So we don't really know how many global cases for a regular flu season, so I just kind of left a question mark there. But we've already hit the high end estimate of deaths, and again, different time frame, different number of cases. Pan flu was particularly lethal, but you can even see that significantly more people caught it, and like 10 times more people caught it than have COVID right now, and we do not have a tenth the number of deaths. So this is a deadly disease that you do not want to catch if you can avoid it. It's not just a cold. Seasonality is generally there with the flus that we are not seeing with COVID. We thought we might because we were seeing this drop, but it was likely just from all of the interventions we were putting on with staying at home and wearing masks and all that. So not really seasonality to it. And the last little like super geeky sciencey thing that I just find really fascinating, so bear with me for a second, is around mutations. And the flu really, really likes to mutate. And so what happens is when they copy their RNA, DNA kind of thing, when they replicate, they don't do a good job of checking themselves to make sure that it's a correct copy paste. So they make a lot of mistakes. That's why we have so many different strains of flu, and the flu mutates, and you get all sorts of different little quirky H1N1, H3N2, all those different things. It's because it likes to not check itself when it copies itself. So what likely happened with the 1918 pan flu is about a third of the global population caught it. That's a lot of people. However, that's nowhere near herd immunity, and they did not have a vaccine at that point. But it went away after about 2 years. And what likely happened is it just died off because it mutated so much that it either became less infectious or less deadly. They're not sure. So some people are thinking that COVID will just go away, just like the pan flu did, even though it took 2 years. And it probably won't, because COVID, while it's similar in terms of copy pasting itself, it does a really good job of proofreading itself and checking to see how well did I copy myself. So it doesn't mutate very often, which means it's probably not going to just die off like the pan flu did. On a happier note of that, it probably means that a vaccine will be very effective, because the virus that we're working to build the vaccine with will probably be very similar to anything you would get exposed to once you're vaccinated. So super geeky, detailed, sciencey piece of it, but I thought that was kind of fascinating that no, it's not going to die off like the pan flu did, because the flu likes to not do a good job copy pasting itself like COVID does.
And Mr. Chair, I've just got one comment on this slide. And Sam, the mortality of this seems phenomenal compared to the pan flu or even the regular flu. But with the pan flu, we have had 100 years of significant medical progress that appears to not be of consequence. I mean, there's
right, yeah. That's a good point too. Yeah, this virus is just, we used to think it was just a respiratory illness, that if we can just support the lungs, they'll be, that should be enough. And it's not. We're finding it in the heart. We're finding it in the pancreas. It's affecting how well your blood coagulates and how thick it is. It really impacts a lot of different systems that the flu generally does not touch. So it's very strange. It's a very strange virus. Yeah, that's a good point. Yeah, 1918, they did not have what we have now. So moving forward, where the heck are we going? Not going away. Pandemic fatigue is setting in. People are over it. I'm over it. I get it. I want to go lick a doorknob and get it and be over with this, but probably not a good idea. So I'm not actually going to go lick a doorknob. So it is going to be cycling through for months, years to come. And so the thing that's crazy to me is that they estimate that about 5% of the US population has had it, so as of right now. All of this disruption, all of these businesses closing, these massive interventions across the state and country for 5%. we need to get to 70% to have herd immunity, which I don't want to do the math and how long that would take us. So we either need to get used to this and be okay with whatever interventions we put in place to make this manageable long-term until a vaccine can come around. And hopefully next year, I don't know. I'm not, who knows? It could. There's a lot of people working on a vaccine. But whether or not that comes is just a fingers crossed sort of scenario. So we really need to work at balancing. Okay, public health. We need to not be Florida, because Florida's a really bad example right now. But balance out the economics of the business. How do we do this while maintaining business? Like, I think HHS is a great example of how we do that really well, where we're still supporting people, we're still supporting families, the community, while keeping our staff safe and keeping up our business while balancing public health. You also need to look at healthcare capacity, look at that hospital in Florida that has hospital beds in the atrium. That's not really ideal. So just balancing those out and keeping those different metrics in place and thinking through when you make choices, is this a good public health choice? Is it good for business? You have to balance them all out. And it's a long game now at this point, where you just think, we used to think about this in like, okay, what can we manage for the next week, for next 2 weeks? That was COVID time, was 1 to 2 weeks. And now at this point, it's what can we handle for months? What can we put in place that we can do for months? And public health will be here. We're still going to be doing what we're doing. We might end up doing community testing or barrier-free testing, which you've seen down in the cities. So we might end up doing that. At some point, we'll have a vaccine, and then we'll be there to distribute that en masse. But until that comes, it's just keep trucking along and trying to figure out how to do this sustainably for months, because that's what it's going to be. So it's a lot of data, but it was visual data. Do people have questions about my data? Ooh. Don't mute myself. Stop sharing.
Thanks, Sam. I think, as we moved, we haven't gone very many places. We went to Duluth this weekend, and we commented about that town has kind of figured out how to do it, but how differently some stores and restaurants have reacted or interpreted the rules. And I think we felt comfortable any place we went. If we didn't feel comfortable, we didn't go. We backed out of the store. But the restaurants seem to all have a plan where you either had to call ahead for reservations or you waited a long time, and they only allowed so many people. And so that was interesting.
Yeah, I saw an interesting analysis over the weekend that they took credit card data, like anonymized credit card data, across multiple states, and there was a solid correlation doesn't equal causation, between increased credit card usages at restaurants with an increased number of cases, and an increased usage in grocery stores with a decreased number of cases. So you can kind of see that, if people are more willing to stay home and, just buy groceries, those cases are kind of more manageable versus people being more and more willing to go eat out at restaurants, particularly down in like the South, where, the requirements for these restaurants are probably a little less stringent than Minnesota. They're seeing these upticks because it's people sitting in one place, closed air, with the air conditioning for long periods of time as you sit there and eat. So I do think Minnesota does a better job than down south with restaurants. But it's an interesting correlation.
Thank you. Any more info?
Mr. Chair?
Yes.
I've asked a number of questions and I don't want to monopolize, but I just have a few thoughts if I can share them.
You go right ahead.
If now is good. So we always, in hindsight, say, I wish I would have known then what I know now, right? And so for me, this is one of those kinds of moments. And so I'm really appreciative, Sam, of you taking us back and even opening up with the perspective that this is kind of the same data that I've showed, you know, week after week of number of cases and stuff. But what does it really mean to us? And what I learned over the weekend or over the last week is I went to the grocery store in Crosby twice, once on a weekday and once on a weekend. And on the weekday, almost everybody had a mask on. And on the weekend, almost nobody had a mask on. So my going to the grocery store in Crosby on the weekend has made me a mask person, because it dawned on me that the people shopping on the weekday were probably the people who live there and they care about themselves and their community. And the people who were shopping on the weekend were all the out-of-towners who come up for the weekend. And it just, I don't know why, but that contrast struck me. But it made me realize that my decisions matter as an individual, and then our decisions as a county matter, right? So when Sam says some places didn't follow the science or follow the public health guidance, we really didn't follow good public health guidance when we opened our courthouse. She didn't tell you that, right? But I will tell you that. But we made a decision balancing public need, our expectations of what we think county government should do, and public health, right? And so when we opened the courthouse, I think we've done okay. I don't know that we've had a bad outcome by doing that, but it made me reaffirm that the decisions we make matter. And so looking to our other facilities, like our social services facilities that are functioning without that walk-in service, we should maintain that by appointment only status as long as we can, because that's a decision that is supporting the good science and the good health of our workers in our community. And there's three facets, what I think about our organization. There's three things that I think we're making decisions for, or that we're I'll use the term managing in this case. But there's customer management, right? How do we manage their needs and their expectations? And then there's workforce management, because we have employees and we're an employer. And then there's workforce support. And by that, I mean all of our workers have obligations at home. They might have young children, they might have elderly parents, they might have a spouse, you know, who's in or they themselves may be in a compromised position where they have a heightened concern for their own health. We're going to have to figure out, at least for the next 6 months, probably longer, right? There's no line that's visible, how we manage all of those. But what really the conclusion, and clearly while on vacation, my wife and I had many conversations while enjoying the lake. But one of them is schools, right? What is going to happen to schools in the fall? And my concern is that if schools start the year like they finish the year, we're going to lose a generation or a year of education of people, right? My children included, who are not going to advance how they should. And so for me, a lot of my thinking is going to be clouded by how do we move the finish line closer so that schools can have some in-person contact. And if we look around, we know there are solutions. We know there are ways that we can manage using precautions and modifying our behavior in the least restrictive way possible to allow us to live life without undue risk in transmitting the virus. So I don't know that I have reached any conclusion other than as we move forward, we really need to, I think, recognize that individually, my decisions matter, and collectively as an organization, our decisions matter. So let's choose wisely. And maybe that's after spirited conversation and debate, right? I don't know that there's a book that you go to that's going to say, here's what you must do. But as I look at my screen, because I can see all of you, I know collectively there's a lot of intelligence and there's a lot of community thoughtfulness that's at play. And so I just encourage us to be very thoughtful as we move forward over the next several months.
Mr. Chair.
Yes.
So Dave, do we, in talking about where your employees who might come to work and worry about their families when they go back home, and that comment you made, do we have any employees that are, making those statements to their immediate supervisor where they feel like there's a risk when they come to work? Are we hearing that in our group of employees anywhere?
Yes, we're hearing that. And I'm sorry, Matt, your last part trailed off. You said, and are we?
Are we hearing that from our employees? When are they talking to their supervisors that they feel like they're exposing their family, their at-home life?
We do have employees with concerns. There are some who have expressed them. Jackie, I don't know if you want to give any insight or what you're hearing. I know our goal is to be as accommodating as possible, but we also have to be sure that services are being delivered, right? So we have to weigh and balance those needs.
I can comment, and there has been, I would say, what's been expressed to me or what has come back to me has been limited. It's been a handful and not, 20, 30 people. But I think for when it's happened in the courthouse, part of it was now we've been away from the office, or now we've been so protected, and now we're coming back. And I think there was that initial fear, but as things have gone well and certain safety precautions have been put into place, I think people that had concerns are feeling better. Now, I would say there's still a person or two that I know of that remain concerned, and it's just kind of one day at a time. But really, in summary, I haven't had 10, 20 people. I've had a handful, and that's been just my personal experience.
And one of the best things that we can do is to keep the number of employees at the work site as low as possible.
Mr. Chair, members of the board, if I could just speak up a little bit. I think in Health and Human Services, we have a full gamut of people. We have people who are, to use Sam words, like over it, who just want to get back to normal and whatever normal looks like. I've probably seen the most, I don't want to call it resistance, but most irritation maybe from social workers because they're social workers. So it's really not in their nature to hunker down and not be, not have those face-to-face visits, but we're coming along, we're working with them. But I've also seen the other spectrum where people are very concerned and they do report that to their supervisor. And right now, for example, we have a lot of waivers in place. And so we don't require a lot of face-to-face contact right now. And some of those employees are in the higher risk categories based on underlying conditions or other factors. And they're just very nervous about even having to come back to the office and sit next to people. And so I think the ability to have a conversation about teleworking in the future is a great option for them, also because it's working well, right? And so we have both of those things going on. I think we're an example of a business or an organization that has had to learn how to function on the fly with this and do the best that we can. And I think at the end of it, we've learned that a lot of our business practices can be done more efficiently. So that's all.
Yeah, that does. Thank you. That was going to be my next question. How many are pushing the other way? I want to get back out there.
I think one of the things that we can do as a public, who we are, is set the example. And we don't want to be the example that says, well, look at the county. Why should I do anything any different? Look at the county. They haven't changed a thing. And we have changed a thing. We've changed a lot the way we do business. I see some very positive things that how we're doing business, and I want to continue that. And I think our the way we're doing business right now is getting the work done that needs to be done. And I think we just have to keep monitoring that. We have to follow the guidelines that the state and federal government gives us. But I think we are setting a good example of how we can allow people to work from home and still get the work done. And some of that is due to the fact that we have been granted waivers. We understand that. But I think we have pushed very hard to have the state allow us to continue with those waivers, and some of them will continue for 60 days past the emergency. Some of them we know right now will continue till next June 30th. So I think we're in a good position to continue doing business in a good way.
I agree. I think we had done a great balancing act right from the beginning on this thing. So.
And I think it's very difficult for us to say to a business that we would say, you got to change the way we're doing the business, and then they would say, well, you guys are doing it, why can't we? And so I think we're in a good position to be the example, the leaders. So thank you, everyone. I don't, unless somebody has anything else to add. Thank you very much, Sam, for that report. I always learn a lot from those things, and I appreciate the work you put into it. And I know some of this stuff gets to be like the same old thing. We've heard all those reports before, but I appreciate how you got it, so it made sense to us.
Here to help. So I'm glad it was
Anyway. Hey, David, any other comments?
No, we're back on July 7th for our regular board meeting. And the committee on the CARES Act funding will report back as information develops. And
thank you.
If you want any of those charts, that Sam uses, that one that compares, I think, the US to the European countries and the European Union, just solidifies for me that different decisions generate different outcomes, and we can save lives if we act smartly, which doesn't mean you have to sit locked in your basement, right? But it does mean that you probably can't do everything you'd want to do, and you should wear a mask.
Yep. And technology committee meets tomorrow?
Yes.
And I think, look on your calendar, guys, we still have business. We are still continuing to do business pretty much as normal in a lot of cases. So thank you. No other business. We'll declare this meeting adjourned. Thank you, everyone.
Yep, thanks.